If you are an expecting mom or a new mom, this edition of Being Well is just for you. Nurse practitioners Nicole Wochner and Leslie Taggart from Sarah Bush will be here to answer your most common pregnancy questions. Everything from getting pregnant, morning sickness, foods to avoid, and a whole lot more. These moms will share their personal and professional experience. Just ahead on this edition of Being Well. Production of Being Well is made possible in part by Sarah Bush Lincoln Health System, supporting healthy lifestyles, eating a heart-healthy diet, staying active, managing stress, and regular checkups are ways of reducing your health risks. Proper health is important to all at Sarah Bush Lincoln Health System. Information available at sarahbush.org. Dr. Ruben Boyajian, located at 904 Medical Park Drive in Effingham, specializing in breast care, surgical oncology, as well as general and laparoscopic surgery. More information online or at 347-2255. Rediscover Paris. Our patient care and investments in medical technology show our ongoing commitment to the communities of East Central Illinois. Paris Community Hospital Family Medical Center. Thank you for joining us for this edition of Being Well, and today we're talking to expectant and brand new mothers out here, and I have two experts in the studio who are going to answer all of our questions. I have Leslie Taggart and Nicole Wochner from Sarah Bush Lincoln Health System. Thanks for coming by, ladies.
Thank you. Thanks for having us.
So tell us a little bit about your background. Nicole, I'll start with you.
I'm a women's health nurse practitioner at Sarah Bush, so I focus pretty much, gynecology, obstetrics, pretty much anything to do with women. I graduated with my master's in nursing from Vanderbilt and then came here to Sarah Bush, so I've pretty much spent my whole career here at Women's Healthcare.
All right, and Leslie?
I'm a family nurse practitioner, but my background is in labor and delivery, so I've kind of graduated through the years as a staff nurse and went back to school. I did my graduate work at Indiana Wesleyan, and Nicole and I share a practice, so we do the same types of patients, gynecology, OB, and everything in between. So. And
you're also mothers. Between the two of you, you have a lot of kids of different ages. Yes. So you have this blog called Stethoscopes and Strollers, correct?
Yes.
So tell us a little bit about what you talk about. What are the topics that you cover in that blog?
I think we try to mix it up with a little bit of everything. Obviously it's pretty much all focused on women's health issues or things for, pregnant women, new moms, postpartum issues, and then some fun stuff too. We do some stuff on like our favorite baby products, recipes, things like that. So kind of the whole gamut of, maybe some of the stuff you wouldn't otherwise ask a girlfriend or talk about, but that it can kind of open up the door to that.
All right. Well, we looked at the blog and we took some topics from that, and that's what we're going to form today's discussion about. So I think a good way to get started is this question of what do I need to know before getting pregnant? What do I need to do to ensure that I have a healthy pregnancy?
A lot of patients we find are very unfamiliar with even how to get pregnant. So that whole, like a preconceptual counseling appointment is something that's a great idea with your provider to talk about, that process of how do we get pregnant. Starting a prenatal vitamin is really important. Eliminating, caffeine, nicotine, alcohol from your diet, even if it's months before wanting to conceive, just, getting yourself as healthy as you can be prior to pregnancy is really important. So we talk about diet and exercise, maintaining a healthy weight for you. It decreases risk to you and baby if you're at an ideal weight before you even start getting pregnant. And then we also ask questions about your health history, if there's any genetic factors that are a concern for you or dad, if there's any procedures that you've had done. Just we go over extensive health history, and just knowing all that beforehand helps educate mom and dad about potential risk factors, things that they bring to the table before even conception happens.
So on average, let's just use a woman of, let's say 25 to 27 years old. How long
if there's no fertility issues, does it take for them to get pregnant? How many months?
The average woman, it takes about 12 months to conceive.
Really?
So I think, we have this sort of false picture of pregnancy as just this easy thing that you say like, oh, I'm gonna have a baby, and it just happens. And unfortunately, or maybe fortunately in some situations, it can be a lot harder. It's really sort of an amazing finite process that everything has to fall in place in order for a pregnancy to occur and then to maintain that pregnancy. And so it does get frustrating for women who are at that point where they're like, I'm ready, I have all my boxes checked, I'm ready to have a baby, and then they're 4 or 5 months into things and saying, something's wrong with me, why am I not pregnant? But in most cases there isn't anything wrong. In most cases it's just a matter of that sort of perfect timing of things that doesn't always happen.
Yeah,
because really when you think about it, how many days out of a month can a woman really get pregnant?
1, maybe 2. Yeah, it's literally 24, maybe a 48-hour window, and a lot of people don't understand that at all. So when they come to us and they say, we've been trying for a year to get pregnant, but they are not monitoring their cycles, they have no idea what ovulation is or when that might occur, or what their ovulation symptoms are. So for us, we can say, no, you really haven't been trying for a year. So just, and there's lots of technology you can use yourself. There's lots of pregnancy and fertility apps that help you track your cycles and help you keep track of knowing that's what ovulation feels like. And I'm not a day 14 person, I'm a day 18 person. So just, that's all stuff that you can do at home. The more familiar you are with your body, the more we can help you to see if there really is a problem.
So if it takes a year, at what point do you have patients that come in and say, I've been trying for a year, it's got to be an infertility problem? At what point does it become an infertility problem?
I mean, I hate the word infertility. It's such it's just such an awful word. I just hate it. It's such a stressful experience anyway. And then when you get labeled with infertility, I think it makes it worse. But my impression is, we say kind of 12 months is sort of the magical time frame for us, but also from an insurance perspective as far as getting testing covered and things like that. So at 12 months, whether or not someone's perfectly executing the process of trying to conceive, I think it's a good time to do, just a really basic workup. We always say peace of mind goes a long way.
Absolutely.
If we can say everything looks normal, your hormones are normal, we don't see anything suspicious, that is huge for a woman who's trying to conceive, that can say, okay, there's nothing wrong with me, I'm doing everything I need to be doing, I just need to give it a little more time. So I think both of us, usually around the 12-month mark, for that 20-something-year-old patient, at least consider the option of doing some basic workup.
So what is there kind of an ideal age range where more healthy pregnancies take place, and then after a certain age it becomes more risky?
After age 35 is the number, and I hate using that number because Nicole and I are like, we're at 35, we're right there. That's not that old, but that's the number that they find when they kind of graph, birth defects, birth problems, and age. That's the number where those two numbers intersect. So that's a number where you're considered advanced maternal age, and I think they've even changed the term to elderly. Yes. Yes. Yeah. So at that point, that's when we just, I don't want to say monitor you a little bit more closely, but that's when we pay attention to little things, offer more genetic screening. There's just more advanced things that we can do and offer, even referral, just based off your age. You might have a perfect pregnancy, but we can offer that referral to a higher level of care for a consult, just to make sure that everything looks good. So.
All right, so let's move on to everything has worked out, and you think, I might be pregnant. One of your topics was 10 signs you might be pregnant. What are those?
It seems like a no-brainer, but I think the missing period. I can't tell you how many times I have patients come into the office for an appointment and they haven't had a cycle for 6 or 7 weeks, and when I ask them if they've taken a pregnancy test, they say no. So I think obviously to me, but maybe not to others, a missed period is kind of the number one.
I know personally, I felt even before that happened, breast tenderness, way before that. You kind of feel like your period's coming, but it's not that. So breast tenderness, a lot of people think that they're immediately going to feel nauseated and the morning sickness. That honestly doesn't come for several weeks. So in Nicole's circumstance, if you have somebody who hasn't had a period for 6 or 7 weeks, they might be feeling that. But generally, that's stuff that happens a little bit later.
How about, does your mood change? Do you feel different right away?
Some people even feel dizzy, lightheaded, just off. That's, for lack of better terms, they'll say, I just don't feel like myself right now. But yeah, some people are more sensitive to those pregnancy hormones, and they'll say, I feel kind of like a psycho, or or my husband says I am acting like that.
So it's just those pregnancy hormones are kicking in, and everything.
And they come
is
quickly, and every day they are going up. Yes.
Gangbusters.
Yes.
So do you have some patients that experience a lot of symptoms and others it's just more subtle?
Every woman is so different, and even the same woman from pregnancy to pregnancy, it can be so different. So, with one pregnancy, you may not have really any pregnancy symptoms, especially first trimester, and then with subsequent pregnancies, it can be kind of, every symptom in the book. So that's another hard thing for women is like, well, I didn't feel like this with a previous pregnancy, so what's going on? This is
it
new.
almost makes them nervous, like I'm not feeling those things.
And do we know why some pregnancies you have morning sickness, others you don't?
Patient's age has something to do with that, because obviously, you're getting older, and then maybe having another baby at home, or a different life circumstance with different job, and then sometimes everything could be the same, and it's the way your body chemistry is working.
All right, let's talk a little bit about morning sickness. When I know, as you just said, no pregnancy is the same. When typically does morning sickness, if you're going to get it, when does it kick in?
6 to 7 weeks is typically the time where most women start to experience the most, nausea, and morning sickness is kind of the term that we've coined it with, but it really can sort of be 24/7. So, but yeah, 6 weeks is kind of when it typically starts, and by 13 to 14 weeks, as you get out of your first trimester, a good 70% of women have pretty much resolution of those symptoms, but unfortunately there are those patients who kind of continue with it even throughout the pregnancy. But for the majority of women after the first trimester, it does get better, thankfully.
Yes.
So did either of you have morning sickness with your pregnancies?
Yes.
They're nodding their heads yes. Any tips that you can provide our viewers to get through that you think work really well for you?
People immediately think medicine first. There's actually lots of non-pharmacological things that you can do to help with that. I encourage patients to eat like 4 to 6 small meals through the day versus 2 or 3. So it's going to be different. When you have like a stomach bug, not eating generally makes you feel better. This is going to be the complete opposite. If you feel nauseated and don't eat, that's just going to compound that nausea. So I encourage to cut back on dairy and meat. They're fat. The way your body breaks that down is harder on your gut, and that causes more nausea. So dry, bland foods. So like cereals, pastas, fruits and vegetables are good. As long as they're not covered in like a big heavy sauce or something. So yeah, just think light and easy, and lots of fluids is the big thing. Just frequent water, even if you can't hardly keep anything down, just small sips. You don't have to drink a whole gallon all at once.
Nicole, any things that
I
you tried?
had really good luck with, there are these, they're called Preggy Pops, which is kind of just sounds ridiculous, but they're like little suckers, and they make little candies, hard candies to suck on. And those were a godsend for me. And I don't know if some of it was just sort of all in my head, but I felt like maybe it helped a little bit. I was unfortunately one of those people that didn't have resolution of my nausea after the first trimester. So I pretty much threw up until close to 30 weeks. So the hard candy, something kind of just to suck on, helped. And sleep is huge too. I think if you can get enough sleep, I always get more complaints from women with nausea, especially when they're not getting enough rest. I think obviously with everyone, when you're tired, everything's that much worse. So, especially with pregnancy too, you're so fatigued in that first trimester. Sleep, let yourself rest. Because that makes a big difference.
So just ask your healthcare providers, ask your girlfriends, and try some different things.
Everyone's different. So what works for Nicole might not work for me. So just don't give up. It will get better.
So let's talk about those prenatal visits. When does the first one typically start and how often do they happen throughout the pregnancy?
And every office is a little bit different how they work that. In our office, we see the patients first around 6 or 8 weeks, and they do what we call an ACOG visit, which is we fill out with a nurse their prenatal record, going over mom's health history, dad's health history, and then the nurse does a lot of teaching. Gets their first appointment set up, tells them what's normal. It's a great time for them to ask. We have a lot of questions during that time. Can I eat this? Can I travel there? Just little things like that you just aren't sure. And then generally after that, when you're about 12 weeks, you'll see one of your providers. So you would see Nicole or I or one of the physicians, and we would do a pretty extensive health assessment as well as an ultrasound to confirm due dates, because a lot of our patients are not sure about when conception happened. And then we do some lab work at that first appointment.
Okay, so then how often will you be seeing your doctor?
We see patients every 4 weeks through the first and second trimester, and then starting at third trimester, which is around 28 weeks, we start 2-week visits, and then weekly for the last month. So I always tell patients, the further along you get, the more often we're going to want to see you and check out baby.
So that first visit, when you're doing that health history, you should come prepared with that information.
Yes, yeah, that's huge. Talk to your mom. Yes. They're always on the phone with their mom. But yes, yeah. And we usually say, if you don't know, then you probably don't have, those things. But yeah, just know your health history. Have dad be familiar with his health history too, because a lot of dads are like, I didn't know that they'd be asking me questions. So.
Okay. Yeah. Another common question. How much weight should I gain during
sensitive topic.
What's the recommendation?
Well, for a woman of a normal BMI, a woman who isn't overweight to start with, 25 to 35 pounds is kind of the typical weight gain that we've always talked about. But, that doesn't apply across the board, unfortunately. When you're overweight to start with, we have a lot of women who start out with sort of an elevated BMI or overweight with pregnancy. And so if those women can gain, closer to 15 pounds, it makes for less risks with pregnancy, less high blood pressure complications, less gestational diabetes, which kind of goes back to what Leslie was saying about, if you're thinking about getting pregnant, doing the things you need to do with healthy lifestyle and trying to sort of get your weight to a manageable point before you get pregnant is so much easier, just because it is stressful to have to worry about, how much weight you can gain because you're overweight to start with. So getting at that healthy weight, which we understand is not easy, but kind of being there when you start just makes things so much less complicated.
So the old days of, I'm eating for 2 and it's a free-for-all, those are so
You only need 300 extra calories a day of good calories, not junk, which a lot of pregnant women think, like you said, they can eat it's like whatever.
Have a
absolutely, absolutely.
What about exercise during pregnancy? Let's talk about for people who are regular exercisers anyway. What are your recommendations for their routine that they can maintain or keep up?
We encourage patients to keep exercising unless we give you some kind of restriction or you've had some kind of complication. Generally, you are free to do whatever you are doing. I always say, don't worry about trying to become a bodybuilder. We don't want you lifting. Don't worry about bench pressing. But cardiac activity is awesome. Walking, water aerobics, running. We have a lot. Running is really popular right now. Go for it. Keep running as long as you're comfortable running. You're going to get to a point where probably it's going to be a little bit uncomfortable, but as long as you can do it, keep doing it. Activity during pregnancy is huge, absolutely huge in maintaining that healthy weight, healthy blood pressure. It actually will help you have a smoother labor and delivery. If you're toned and in a good physical shape, you will recover faster from delivery. The delivery process itself will go faster. So it has multiple facets where it's so important to keep exercising.
Are there any exercise activities that you say, well, maybe that's not the best for a pregnant woman?
I mean, obviously anything where you're putting yourself at risk for, like injury, like, downhill skiing, things like that. And the other thing too is, with lifting weights, thankfully right now, I think in our society, it's sort of getting healthy and exercise and all of that is becoming a lot more popular. So we do have a lot of people that are sort of in a routine of lifting weights. And some of that, honestly, throughout pregnancy isn't a problem. You just want to kind of maybe scale back on the amount of weight that you're lifting.
Okay.
But honestly, there are really pretty few exercises that you shouldn't be doing with pregnancy, especially if it's something that you've already been doing and that your body's used to. You really can pretty much continue that throughout and do well with it.
Okay. Are there certain foods, or I mean, we know that, okay, you shouldn't drink alcohol when you're pregnant, you shouldn't smoke. Are there foods or drinks that you recommend pregnant women should avoid?
We get a lot of questions about seafood. You know, people are like, I'm getting ready to go on vacation. Like, is that okay if I eat fish while we're, you know, in Florida or whatever? And absolutely, if we lived in like a coastal area where, you know, fish is like something, fresh fish is something we eat like multiple times a day, that's a different story. But here, by the time we get that fresh fish, a lot of those issues aren't such a big deal anymore, and the frequency that we eat fish is not that big of a deal. So I always say I would probably avoid raw fish, and a lot of people again don't really eat that in our area, but raw fish is something you want to avoid. A lot of questions about lunch meat, if they can eat that or not because of listeria concerns. Most places, again, make sure if you're at a restaurant, it's, you know, a reputable place. It's not some hole in the wall. If it seems suspicious, it's maybe something you might not want to order, or, you know, warming up your lunch meat can help reduce any risk as far as that concerns. Those are usually two biggies that we get.
Yeah, I think the other one too is non-pasteurized cheeses.
Yes.
Okay.
So like, you know, brie and, you know, feta. We're cheese girls. We like cheese.
Yes.
So, excuse me. That would be one that, you know, in our area, we probably do actually have access to some of those things.
And what is it about the unpasteurized cheese that is
The
bad?
potential for bacteria, especially even like right now with cider. There are a lot of, you know, it's apple cider season. A lot of local places might not pasteurize it, so they aren't warming up the product to a certain temperature to kill off any potential for bacteria. So the mom could ingest that, and then, you know, it could cause problem that way. But again, in the area we're in, the chances of that are pretty slim. You know, granted, if you were in a different country, your risks are so much higher. But in the States, it's pretty uncommon, especially in the Midwest.
So we've talked about some foods to avoid. What about caffeine and soda and coffee and tea? What are your recommendations?
Well, in our caffeine-laden society, I generally tell my patients to try and limit it as much as they possibly can. But we have some people who are Starbucks addicts, and they're like, "Are you kidding? I can't give that up." I generally say, you know, one caffeinated beverage a day is fine.
Okay.
And if you even want to drink a bottle of water, that'll offset that caffeine that you drink. So we want you to drink a gallon of water while you're pregnant every day. So, you know, you just might have to drink a little bit more if you really like your coffee. So.
It's worth it.
Yes, absolutely.
All right, let's talk immediately after you have the baby. I'm sure you get this a lot. Talk about what women should expect out of their body after they've given birth.
I think sort of maybe expect the unexpected.
Okay.
I mean, your body goes through a lot of trauma with labor and delivery, and so give your body time to heal and expect that it's going to take a minute to bounce back from that. You know, you're going to have to deal with sort of the new challenges of breastfeeding if you're sort of charting that course, and, you know, the vaginal bleeding that goes along with things, and, you know, soreness from delivery and all of that. So I think so many women sort of rush to get back to normal, and I think let your body have time, give yourself time to take it easy and heal, because you're going to be so much better off in the long run if you let yourself relax.
Yeah, and just, you know, physically relaxing, and then also all those pregnancy hormones, I would imagine, are now out of your body. Just letting that get back to a normal level.
And that is not a process that happens overnight. You know, I tell people it took me almost a year after I had my first baby to kind of feel like, all right, I feel like a normal human again. And, you know, physically I was fine, but just emotionally, just finding that groove, finding that schedule for you and your baby, getting back to work, finding that time for you and your partner, which has obviously changed significantly now. There's just little ones. So it's a huge change in every facet, but it's worth it. It'll get better. And talk to your friends. Just don't, I encourage patients, don't just like shut down. You have to let people help you. And I'm somebody that I don't like to ask for help, but you know, having your mom there, having a girlfriend there, your grandma, let people come over and help you, even with, you know, the normal household chores, or let them bring supper. That's not a sign of failure or weakness.
And I always tell people, when people offer help,
Yes.
they really want to
Yes.
give help. They're not
Absolutely.
just doing it with the hopes that, oh, I hope she doesn't take me
Yeah,
up on it.
no,
So
people
take
genuinely
up
want to
on it.
help.
Yeah. Let's talk about, we only have about 2 minutes left. I want to talk about symptoms of postpartum depression. Give me some thoughts on that.
I think a lot of women struggle with baby blues. We know that a lot of women struggle with baby blues. As we talked about, you know, your emotions and your hormones really kind of go crazy after you have a baby. And so it's not uncommon to have a week where you feel kind of blue and you are sort of more tearful and you do cry more often, and everything's just sort of, those emotions are sort of right on the surface. But for most women, after the first week to 10 days, that does start to kind of taper off. But there are women who do, struggle with postpartum depression, and that doesn't always look like the same picture as normal depression would in a non-pregnant or non-postpartum person. So sometimes it manifests as anxiety or almost paranoia about fear that something bad is going to happen to the baby, or that you shouldn't leave the house, or that you're not safe. It doesn't have to be, I'm sad and I don't want to be around people or be out of the house. It can really, I think for a lot of women, especially postpartum, be more anxiety driven, just because you do have this new little person that is your world. And so that sort of hormone change and depression can more manifest as concerns and anxiety about the baby.
So what are the treatment options for that?
I think a lot of it is therapy, talking, and it doesn't have to be talking to a counselor or mental health provider, but talking to someone that you trust, that you feel safe being honest with, and just getting that out there.
Yeah, absolutely. Like I said, a lot of people want to just like, oh no, that would make me sound like I'm not a good mom, or that I'm not adjusting to life as a mom. So they like compartmentalize that. So yeah, just getting it out. Talking to anyone. A lot of people think, well, I have to go talk to a licensed therapist. Absolutely not. Talk to your mom, talk to girlfriends, because they've probably been there and might not have said anything about it. So.
But talk to your healthcare provider too, because that's what we're there for. And then if it is going to that next level where just kind of talking through things and moving past it isn't going to help, there are so many medication options available. That isn't something that you're going to have to be on for the rest of your life, but it's really important because postpartum depression can sort of evolve into something really serious called postpartum psychosis. That's really scary. I mean, we've sort of all heard those crazy media stories about moms that kill their babies, or and it's reality. It does happen. So be honest with your healthcare provider, because we want to help you work through it and be there to sort of help you with your options and what you need.
All right. Well, we didn't get through everything on the list, so I guess that means we'll have to have you ladies back again.
We'd love to.
Well, thank you so much for coming on Being Well and talking to our expectant and new moms and giving us some great advice from two moms themselves. Thanks for stopping by.
Thanks for having us.
Production of Being Well is made possible in part by Sarah Bush Lincoln Health System, supporting healthy lifestyles, eating a heart-healthy diet, staying active, managing stress, and regular checkups are ways of reducing your health risks. Proper health is important to all at Sarah Bush Lincoln Health System. Information available at sarahbush.org. Dr. Ruben Boyajian, located at 904 Medical Park Drive in Effingham, specializing in breast care, surgical oncology, as well as general and laparoscopic surgery. More information online or at 347-2255. Rediscover Paris. Our patient care and investments in medical technology show our ongoing commitment to the communities of East Central Illinois. Paris Community Hospital Family Medical Center.